Uri Susser. My friends call me Buzz. I'm an MD, I'm a family practitioner, and I'm one of the early workers in nutritional, holistic, alternative, eclectic, whatever you want to call it, medicine. I've tried it all. I started back actually in 1968 when I serendipitously read a book about vitamin E when nothing else seemed to be working very well on many of my patients, and I tried vitamin E, had a remarkable result, and it was back in 1968 when the use of vitamin E was really considered quackery. It's hard to imagine in this day and age that anybody would really consider that quackery because some of the things have changed in the last few years. But I think some of the change has to do with the persistence of many of my colleagues and I in continuing to use this stuff in the face of criticism. It's an enormous amount of criticism. I was called the vitamin E doctor, the quacky doctor. I took a lot of heat from my colleagues in those days. I did a lot of hospital medicine in those days, and I'd go in and sit down at the dining room. In the dining room, after I got a reputation for using this vitamin E, people would get up from the table and move to the next table when I sat down, and even though I had showered and everything. So the use of vitamin E, the use of vitamin C, those things came to me in the late 60s, early 70s out of desperation, out of the failure that I experienced with orthodox medicine. And at first I thought it was just my inadequacy, my inexperience, my lack of knowledge. And of course I did everything to correct that. I would send these people to specialists, even to special clinics, University of Pittsburgh, which is where I studied and used a lot of consulting there. And I would send people to major centers, Mayo Clinic and Johns Hopkins and Harvard. And all I did was get back longer letters which told me that they couldn't do any more than I could. So out of desperation, I kept trying new things, trying things that might work. I thought of psychiatry. I tried a lot of office-based psychiatry, which was really a major failure. I wasn't much of a psychiatrist anyway. But then psychiatrists didn't do any better than I did. So when I got into vitamin E and found that worked spectacularly well on a couple of serious patients, might be worth mentioning one that was really an eye-opener for me. It was a lady who had swollen legs from venous insufficiency. She had a condition in those days. It was called phlegmasia alba dolens. Phlegmasia is swollen, alba is white, dolens is pain. So she had this phlegmatic, painful leg, and it was really painful. There was a test called a Richardson test where you could put a cuff around the leg, a blood pressure cuff, and run it up to see what level of pain, what level of pressure experienced pain. Well, she couldn't even take the cuff with no pressure other than the cuff itself. And then I, out of desperation, out of reading Wilfred Schutz's book on vitamin E for ailing and healthy hearts, I tried vitamin E on her. And I was really scared. I didn't know anything about vitamin E. And it was amazing because this is a woman who had been treated for this condition on and off for 30 years, had surgery, had every drug known to man. The reason I tried vitamin E is because there was nothing else in orthodox medicine left to try. And I tried vitamin E, and in 3 weeks she made a major improvement. And in 6 weeks, I put a cuff around her leg. I ran the cuff up to 300 millimeters of mercury, which is the maximum the cuff will do, and she was pain-free at 300. The swelling had gone away, and she was essentially cured. That was a remarkable gift because you don't usually get that kind of good results even with vitamin E or anything else. But it was a remarkable eye-opener. Some people say it was divine intervention. It was something magnificent that I saw this, and I went very excitedly to my colleagues in the hospital and told them what had happened, and they all scoffed at me. You're crazy, it's placebo. It was not placebo. It was an effect. This woman had been sick for 30 years and got better in 6 weeks, and the only difference was vitamin E. So there's no question in my mind it was vitamin E, and I've done a lot of similar things since then. I could tell you story after story like that. The point is, it opened my eyes, and I was willing to look. I was desperate for truth. I was desperate for results. And I didn't feel that I was getting enough truth and results from conventional medicine. So that started my odyssey. I found out about IKID, the International College for I forget what it's called now, nutritional medicine, something like that. International College, I don't know. It was ICANN, I remember that. It was a long time ago, it was 30-some years ago. But Adele Davis was a member, and I met her, and she helped guide me, actually. She was very kind. She was excited to have a physician who was interested in nutrition, and she helped guide me along the way. And I started using more and more nutrition in my practice and finding out more and more tricks. And Carlton Fredericks was helpful in those days, and other nutritional doctors, Bill Ellis, who was one of the doctors, and some of the people from Standard Process Company. Some people there who were a lot of help. So I got help anywhere I could get it. Certainly I didn't get it from orthodox medicine. They were no help at all. All they said was that everything I did was talking about was quackery. I learned about intravenous vitamin C from Bill. I don't know why my memory is escaping me.
That's all right. You can come back to it.
Anyhow, it's Linus Pauling had learned much of his stuff from. I can't forget. I can never forget his name. Clement, Bill. Anyhow,
You'll remember it later. You can
yeah.
come back to it.
So okay. Anyhow, I learned about intravenous vitamin C from the doctor who originated it, and I started using intravenous vitamin C. I used the vitamin C in intravenous pushes and in large doses of intravenous infusions, and I started using oral vitamin C according to what Linus Pauling taught me. So I was starting to get remarkably good results. I was getting miraculous things happening with these conditions. About that time, 1972, I learned about chelation therapy. I was at an ICANN meeting, and I met Dr. Harper, yeah, Dr. Harold Harper, but more the man who really was Evers, Ray Evers from Alabama. And Ray Evers was an incredible pioneer in chelation therapy. And he had learned it from Carlos Lamar, who had learned it from I've been taking too many memory pills.
Come back to it later.
So I need more chelation myself, I think. The chelation was a remarkable eye opener. It was a spectacular treatment for vascular disease, for many other degenerative conditions, and I learned it from Ray Evers. I traveled by strange flights down to Andalusia, Alabama, where I learned chelation from Ray Evers, and went back to Pittsburgh, Pennsylvania, where I was practicing at the time, and started doing chelation, again with great trepidation, but the results were so remarkably good that I could not do it. About that time, I was getting more and more into nutritional therapies. I learned about hypoglycemia. I learned about simple nutritional tricks that would work. So things like giving calcium and magnesium at bedtime for leg cramps. Simple things that made a huge difference in people's lives. And I was learning these tricks about hypoglycemia and treating people with various ailments nutritionally. And I had a bad week about that time. I had people in the hospital were making a lot of fun of me. I had a couple patients who got really irate at me because I'd given them vitamins instead of drugs, and I got people hollering at me, and I said, "What do I need this for? I mean, what do I could give out penicillin and Valium and all these things with the best of them. It's no big trick to use those things. I'm going back to orthodox medicine. I'm going to give up on this nutritional stuff. It's not worth it." So, boy, I had a ball. Next patient came in with hypertension. I gave an antihypertensive drug. Next one came in with headaches. I gave him headache pills. Much easier than designing a nutritional program. And about the fourth or fifth patient who came in, it was getting so easy. I mean, the people were just flying through the office. I've forgotten how easy it was to do it that way, even though it wasn't very successful generally. And I had a patient who came in with headaches and weakness after eating, about a half hour after eating. And it was so clearly hypoglycemia. And I wanted to go into his diet and say, what are you eating? Sugar? What are you eating that could be triggering this? Eating colas, caffeine, alcohol. What are you doing? And I started to write out. I'll give him some Darvon and some Valium. Darvon for his headaches, Valium for his nerves. And I got this wave of depression. I almost felt sick. So I said, I know what's wrong with this guy, and it's nutritional, and I can't not give him a nutritional treatment when I know it's exactly what he needs, and I know exactly how to do it. And for me to give him Darvon and Valium is malpractice. And I said, okay, here's the story. And about that time I realized that I had bitten of the apple, I had tasted the tree of knowledge, and I couldn't go back. There's no way to go back after you've experienced that. So I asked him about his diet. It took a lot longer than giving him penicillin, or giving him Valium and Darvon. And I found out what he was eating. I told him what not to eat. I told him how to eat. Gave him some nutrients to support his hypoglycemia. And I saw him again a couple weeks later. He was much better, and his headaches were gone. It was really easy for me. And we really got to the root of the problem. The guy was grateful. And I've had many patients. I probably had since then over 25,000 patients I've done that sort of thing with. And not all of them get better. It's not all wonderful success stories. But so many of them over the years, it's really been spectacular. About that time, I got involved in the politics of the International College of Applied Nutrition, ICANN, and I got involved in that. And then there was IAPM, the International Academy of Preventive Medicine, and then there was AMPS, the American Academy of Medical Preventics. And I was on the board, and ultimately I was president. I was the fourth president of ACAM, which was then called AMPS, American Academy of Medical Preventics. And in those days, it was really hectic. I mean, there was all sorts of flack flying around. We were really way out there. Harold Harper, who was the first president and founder, one of the major founders of ACAM, he at one time went for 3 consecutive meetings. We had 6 meetings every 6 months, and for 3 consecutive meetings his briefcase was stolen from his room. Now, I've never heard of anything like that. We don't know who stole it. We know we were being watched. We know that there were agencies after us who didn't like what we were doing, and it was a little scary. And we never found out who stole Harper's briefcases. But for 3 of them in a row to be stolen, it's not like they were after money, right? They were after information of some sort. And they got it. They got the information. It didn't seem to hurt, though. So that started a long odyssey of learning and fighting and working toward the whole issue of medical freedom. That's when I realized that we didn't have the medical freedom that we deserved. In that period of time, it started to come to me. If when I was a kid, you had told me that my biggest problem in life would be from dealing with the United States government and the state governments in my profession, I would have scoffed. I said, I'm an American. This is a free country. This is a country of honor and openness, and the government's on our side. The government is a government of the people and by the people and for the people. Well, I guess that ain't always so. That's what I found out. That the government is an organization of good people and bad people, and a lot of bad people have power in government. And a lot of them are wrong about what's true in the world. When I was a kid, when I was an adult, somebody said, if you tell the truth and keep telling it, eventually your word will be the law of the universe. So that's what I endeavored to do in medicine, always tell the truth. The government said we were liars, that we were quacks, that we were frauds, and we had people like Victor Herbert and other luminaries in medicine who would be supporting the government position. Victor Herbert said you never need to take a vitamin supplement. The American diet is totally adequate even if you just eat fast foods. That's what he said. He said anybody who prescribes vitamins for a patient is practicing absolute quackery. Well, we haven't heard much from Victor Herbert in the last few years, have we? He's kind of a has-been now who really, the truth is, a never was. He was a never was who got a lot of publicity and a lot of notoriety. But lately, we haven't heard much as now Orthodox medicine is adopting a lot of the stuff we were doing 30 years ago. And some doctors, I was doing 30 years ago, some doctors 40, 50, 60 years ago. So I was a relative newcomer in the game. But in the present wave, I'm one of the old timers. In the present, when I first started, there were just a very small handful of us. And now there's thousands and thousands, and it's growing, as it should be. But the government, I started to say, is wrong about a lot of things. And they have to be because, that's a big organization and it's hard to find the truth. But I once thought about what makes a person wrong. And I found out there's only 3 ways that a person can be wrong. 1, from ignorance, 2, from craziness, and 3, from corruption. I haven't been able to think of another reason for a person to be wrong. So I started to think of the government. Are they ignorant? Well, they don't have to be. The information is there. Are they crazy? I don't know. They're not psychotic. They don't have distorted views of reality. Are they corrupt? Well, if they are, we can't find the corruption very well. It's well hidden. But of the 3 of them, that's the most likely, isn't it? But who knows? We know they're wrong, and getting them to change direction from their wrongness is often like turning a super tanker. It takes miles and miles to turn a super tanker. It's not like a speedboat. We have enough freedom in this country that we can act like little speedboats on our own. I can sit in my office and give patients vitamin E, even though it's not quote unquote standard of care of conventional medicine. I can give chelation because EDTA, the drug which we use for chelation, is a legal drug, but it's not approved for the purposes we're using it for. We're using it for vascular disease and degenerative disease. It's not approved for that. But we can use it for that because we still have the freedom to use it for off-label uses. It's more dangerous from a political, legal point of view, medical legal point of view. We're more vulnerable to medical board actions and to lawsuits because it's not mainstream medicine. But we do have the freedom to do it. And there's a paradox here with the legal profession that one of the major banes of medical existence is malpractice suits. That there's too many lawyers and too much malpractice, and a lot of it is really abused. But on the other hand, because it is so easy to sue a doctor, that it really, in a way, works to our advantage. That the government can say, doctors have to be careful with these off-label usages, because if they use it in a clumsy way and do something bad, then they are very vulnerable to legal action. So in a way, the legal profession is our guardian in a very strange, paradoxical way. I don't like to admit that because I don't like being so vulnerable to lawsuits and things. But on the other hand, it's a worthwhile trade-off if it gives us the freedom to use these off-label medications and to use vitamins and other therapies that are questionably accepted by orthodoxy, or not accepted at all by orthodoxy. So I got into a lot of the medical political stuff, thinking about how do we get freedom? Where are we lacking freedom? How do we define quackery? We're considered quacks by the Victor Herberts of the world who are bastions of so-called conventional medicine. They call us quacks all the time. They have a whole organization. Stephen Barrett and Victor Herbert and John Renner have an organization called Quackbusters. I don't think they'd know a quack if they fell on it. They don't know. If anybody practiced quackery according to the definition of quackery, it's chemotherapists and a lot of the surgeons. They fall into the definition of quackery, which is the use of an ineffective drug or an ineffective treatment claiming to be better than it is. I think the only real quackery is that quackery which lies blatantly. There are inadvertent quacks who are enthusiasts and who are fooled and believe that they're doing something that's worthwhile when they're not. But everything that I've done over the years, no matter how uncertain it is, I've always laid it out to the patient in the most honest terms I can. I've always said, here's something I just heard about yesterday. Do you want to try it? I have no idea if it's going to work, but it seems like a good idea. Now, I could be condemned for that, but what I feel I'm doing is giving the patient a choice. Very often, that sort of thing has worked. So what I think the answer to medical freedom is going to turn out to be is honesty and education and openness with the patients, giving them the freedom to choose. Freedom to choose is really what we deserve in life. We don't need a government to say, you can't choose peroxide intravenous therapy because we haven't proven that it works and it might be dangerous. But if I can say to a patient, why don't you try intravenous peroxide? You might want to try intravenous peroxide. The government doesn't think it's proved, doesn't think it's any good, but Dr. Farr has done this kind of work in Oklahoma City, and this kind of work has been done. It's been done here, it's been done there, and the dangers are this, and the possible benefits are that, and you give them a fully informed choice and say, do you want to try it? And you know, sometimes they'll say yes, sometimes they'll say no, sometimes they'll say, what would you do if you were me? And you know, those are all good questions. Those are the kind of questions I really encourage. And when they ask enough questions and get satisfied that they're doing something which at that point has a potential benefit. Remember that there are a lot of people who are sick and who go through all the channels of orthodox medicine and get not one whit better and often get much worse. When people start getting drugs out of desperation, I've almost never seen a patient who went to a doctor who didn't get some treatment. And very often the treatments are much more harmful. If they start getting one of these SSRIs, Prozac was the prototype drug for SSRI, an antidepressant. That's not an innocent drug. It works very well for some people with depression, but it also has a lot of side effects, and if you give it to somebody who doesn't need it, I think it's very damaging in potential. It certainly isn't helpful. And many people who take it get worse. So you have a doctor, when a patient comes to him, feels some obligation to give something, whether it's an antibiotic, a painkiller, a tranquilizer, an antidepressant, an anti-inflammatory. There's some sort of drug that's going to be dispensed. And if you dispense a drug like that, every drug is almost by definition a selective poison. That it poisons a part of the body and it blocks, an unwanted action. And I don't want to give people poisons if I don't have to. Now, sometimes some of those poisons are pretty good, actually. I do not fanatically oppose drugs. I prioritize away from drug therapy, but to eliminate them as a possibility completely is foolish. I did that once. I went 3 months without writing a prescription, seeing patients every day. It was an ordeal. It was really hard work. I gave every patient the choice. I said, okay, if you're going to orthodox medicine, you have this bronchitis, this is the antibiotic you would take, this is the cough medicine. But maybe we'll try it with vitamin C and vitamin A and this tonic for your cough and this deep breathing and this moisture. And it took 2-3 times as long to treat the patient. And I went for about 3 months like that. And I was pretty good at herbal therapy and nutritional therapy even at that time. I had a lot of experience. And a lot of people didn't do well. And I wound up ultimately giving them antibiotics. And I said, you got to use balance. You can't just eliminate drugs. It was a noble effort, but some people suffered from it. But they all did it voluntarily. They all did it by choice. I was pretty persuasive. I said, let's try this, obviously. And so you can be persuasive as a doctor, and I really believed in what I was doing. But I learned that it was a foolish endeavor in this day and age when you can get somebody better with nutrients and antibiotics in 3 or 4 days rather than having struggle for 3 or 4 weeks. It doesn't make much sense. Some people, even under that condition, would choose not to take the antibiotics. And they have that option, and I'm getting better and better. It's shortening the illness. So I will do that in that fashion. The message is that people are intelligent. Given the information, they can make an intelligent choice, and I believe they're entitled to their choice. It's not the doctor's choice. It's the doctor's position to give a menu from which they can choose and select and make their own personal choice. And I divorce myself from the need to have them do any one thing. If somebody comes in and says, just give me an antibiotic and a cough medicine, fine, that's your choice. You sure you don't want some of the vitamin C and some? No, I don't want that. I just want to. Fine, that's your choice. Somebody comes in and says, you got a pretty bad pneumonia. I think you better take this antibiotic. They say, well, can I wait a day or two? And I will say, I don't think you should. They say, well, do you think I can get away with it? And I would say, this is a bad infection. I think that you really have to take the antibiotic. And they usually will. I've had a couple of people who didn't and promised me to keep in touch every day, and I gave them the most of everything I could as far as other than antibiotics, and they got by in almost every case. Now, some cases who didn't, who had the second or third day said, I'm getting sicker, I'll take your antibiotic. Okay, so they made a choice, they made a try. I think that's a give and take way to work with a patient. So to give the patient the choice. Some patients don't want a choice. They say, just tell me what to do. That's a choice also. They choose to let me make their choice. That's fine. I'm very comfortable with that. I don't mind that at all. I say, here's what I think you should do. So to me, this is a way of dealing with the future of medicine. This is a way of giving the patient the education and the choice and getting the government more and more out of it. Getting the government away from telling you standards of care. I think it's fine to have a standard of care so long as it's voluntary. If you start using it as a legal tool to criminalize medicine, then you destroy the practice of medicine. You destroy the option for patient choice. You destroy the freedom to progress and advance. Right now we are emerging in a way from the dark ages of keeping alternative medicine stifled. We now have an office, we have a center for complementary alternative medicine. And that center now is doing tremendous research. Their budget was $70 million last year. It started off with $1 million when it was the Office of Alternative Medicine. The organization which I'm associated with, the American Preventive Medical Association, APMA, and other organizations have done a lot of work with Senator Tom Harkin and other senators to get that office, that center, enlarged and more powerful and empowered. And now it's becoming a real force in the healthcare field, much to the consternation of a lot of the higher-ups in the NIH, the National Institutes of Health. They don't like the idea of having a center for complementary alternative medicine. They don't want to spend even a trifle of their budget on that. But we've done it. We have one, and it's prospering, and it's benefiting, and it's growing, and it's becoming a bit of a danger because now they're going to make alternative medicine orthodox. And if they make it orthodox, then they're going to have to say, okay, now you have to do it the way we said to do it because we're the government. And I think that we have to keep in mind personal freedom and personal choice and the freedom to choose. And I think that is really the message that I carry and want to carry forever and ever. That we give the doctors the freedom to practice safely. We make sure that they have. The options to go where they want to go, and we have the words of Thomas Jefferson that eternal vigilance is the price of freedom. So that's where we have to be, eternally vigilant, and keep working.